Hi, everyone. Good morning. Like Ali said, my name is Andrew, and I'm one of the second-year administrative residents. If you haven't already, make sure you text the code EQUITY, as you can see on the screen there. And for the next 45 to 50 minutes, hoping to talk to you all about, so as you can see by the title, Wisconsin and Dane County healthcare disparities and what that could mean for pharmacy practice, looking at it through the lens of equity and inclusion. So as we move forward through this presentation, there are a handful of objectives that I'm hoping that we can get through today. First and foremost, wanting to start off and spending a few minutes talking about the definition of equity and inclusion. Then for objectives 2 and 3, looking at demographic and socioeconomic factors and different healthcare disparities that are identified at both the state and the Dane County level. And then towards the end of the presentation today, hoping to talk about new pharmacy-specific patient care initiatives, and then looking at having a conversation about advancement of equitable and inclusive patient care at UW Health. So for objective number 1, like I mentioned, going to be talking about objectives. And I know we all love to start off grill with some active participation. So with that said, hoping to just take a brief minute here to either one, if anyone's so inclined to unmute and answer these 2 following questions, 2, enter something in the chat, or 3, just take a moment to reflect on what you would answer. And the questions you can see on the slide are, what do the words equity and inclusion mean to you? And then can you think of some examples of health equity? So I'm just going to give a moment and then we'll walk through some of these next slides. All right, so as it relates to the first definition, I wanted to highlight equity. And for those of you who are familiar, you might recognize some of the names for the reference on the bottom of the slide. So I wanted to highlight Dawn Moore and Melissa Ortega, who are past UW Health resident graduates, who were on an ASHP task force focused on DEI and gave a presentation back in 2021. And I thought they had some good definitions as it relates to equity and inclusion. So as you can see, the definition that they presented almost 2 years ago is an act ensuring processes and programs are impartial, fair, and provide the same possible outcome for every individual. So to explain that a little bit further, I think by now all of us have likely seen this image to the right, or at least something similar. Maybe it's the fence with a baseball game and stepping on crates, but they ultimately all have a very similar message. That ultimately equal is not always equitable. And I wanted to briefly go through that a little bit more. So describing the image to the right, if we look at the top, if we think about supporting everyone equal or giving everyone the same step up, that's not always going to necessitate the same results. So as you can see in the image, some individuals are able to grab both apples from the tree, some are able to get 1 out of 2, and ultimately some individuals are still not able to reach either. And I know this is more of a metaphor and it could be for various reasons, but for the sake of this image here, you know, it could be because individuals are different heights. Some of us are taller than others. Another barrier that could present itself is we're in front of a tree that the branch where apples are reachable is higher than others, and some might have more low-hanging fruit where it's easier for them to grab. So really highlighting the importance of equitable solutions, which is that middle photo there where everyone has a different step up based on their specific needs to ultimately provide the same outcome for everyone. And while that is a large goal and focus on this presentation, in an ideal world, the end goal would ultimately be removing those barriers. So although this is a photo with apples, I think it's pretty easy for most of us or all of us to be thinking about how this could apply to healthcare and how we could put similar situations where different individuals need different assistance based on their given situations and potential opportunities to resolve said issues. And for the second part of the question I presented earlier are some examples of health equity. I don't necessarily want to go through all of these one by one. But at a high level, some of the things I wanted to highlight is that third one there, thinking about our patients and the access they have to care and how we can focus on using technology and other different systems or methods to help provide care to those who maybe don't necessarily always have the means to come to us at a hospital or primary care clinic. And then also, I think the fourth one there really provides a unique perspective where we're thinking about those individuals who aren't necessarily able to come in and get care at those regular 9 to 5 business hours, or maybe they don't have PTO at a job or ability to take time off to come in during those normal hours and receive care at times that are convenient for their schedule. Now, for the second definition, as it relates to inclusion, I really like this one as well, where it focuses on the practice of ensuring that people feel a strong sense of belonging. And I think I kind of looked through this one a little bit more as it relates to the employees or the care team, but I think inclusion really means fostering a sense of belonging amongst all individuals, whether that's employees or patients. And to really effectively do so, it takes an intentional effort. And we want to recognize our similarities and our differences. And when both our uniquenesses and our commonalities are valued and supported, I think is really when we have the opportunity to do our best. So really highlighting in the image to the right, we all are a unique piece to the puzzle, but we ultimately have a sense of belonging and also commonality to make that picture whole, which ultimately brings our value to what we bring to the team going forward. All right, now that we went through the definitions, I wanted to highlight the demographics, socioeconomic factors, and then significant health disparities at a state level. So we will start off with some demographic information about the state. So first and foremost, looking at race throughout the state of Wisconsin, we have a largely predominant white population with almost 85%. With also above 5% for the Latino and African American populations. But also wanting to highlight the American Indian population, as we have a lot of different tribes and nations throughout the state of Wisconsin as well. And then as you can see here, the next thing, it relates to the primary language of residents for the state of Wisconsin, which is just over 90% that only speak one language, with that being English, with Spanish, and then a sprinkling of a few European and Asian Pacific Islander languages. Feel free to agree or disagree with me in the WebEx chat, but as I was reflecting, putting this together, I felt that about 1 in 10 med histories completed, I felt like it was a pretty accurate representation of needing to use interpreter services. And then as it further relates to primary language, one of the trends that is being seen is as it relates to the percentage of fluent Spanish speakers. So if you look at the different age groups across the Spanish speaking population in the state of Wisconsin, from the youth perspective versus the seniors, you can see there's a 4-fold increase, so almost 7% compared to only 1.5% of Spanish speakers in the state of Wisconsin. So a trend we'll continue to see as we provide care over the next several decades to patients. Another demographic wanted to highlight the highest level of education for Wisconsinites. So as you can see, for the most part, the majority of the population is at least at a high school graduation level or higher, with associate's degree, bachelor's degree, or graduate's degree, some sort of college degree at roughly 40% of the population. And if you put together all of our high school graduates, we actually rank among the 10th highest in the nation as it relates to states in the graduation rate at above a 90%. So 92.6% of the population are high school graduates. All right, active discussion time for you all. The next demographic piece that I wanted to highlight is in relation to salaries in the state of Wisconsin, and that average within the state is $42,000. I want to pause for some individuals to type in the chat to put their comments in on what you guys think as it relates to which gender makes less, and then when you guess which gender, also put the percentage that you think they make less. All right, I see women and 5%. Any other guesses? Wait a few more seconds. Females and 10%. All right, let's get one more in the chat. All right, 20%, 8%. All right, so before giving you guys the answer, specifically, I do want to highlight on this graph, you can see on the left is relatively overall, but as we go left to right after that first column there is an increase in salary as we have an increase in education across the state. And if you haven't already figured it out, blue represents males and the purplish pink represents females, with gray being the average. For those of you who guess closer to the 20%, you are the closest. So across the state of Wisconsin, the average male earns $50,000 and the average female is closer to $35,000, or a 30% decrease. Now, there could be a lot of different reasons for this, whether that's the difference in seniority roles across the genders, responsibilities and part-time roles shared unequally across genders, looking for flexibility and not focusing as much on pay, but also at the end of the day, just a difference in pay between the genders overall for the same responsibilities. All right, and then for a quick few other demographics as it relates to the state of Wisconsin, if you are born in Wisconsin, the majority of us stay here, so you can see 70%, 73% of Wisconsinites who were born here are still currently living here. We have an 11% poverty rate. If you stack that up to the national average, we're actually doing pretty well, almost 2% lower than the national average poverty rate. As it relates to the labor force participation, 66% of Wisconsin is still actively in the labor force, compared to only 62.1 nationally. I don't know if that means we're more healthy and able to work longer, or if we just have a lower savings and need to work longer. So you guys can ultimately be the judge of that one. Average age, we're almost 40 years old. We are slightly older than the national average at 38.5. Relatively split as it relates to marriage, just over 50%. Believe it or not, I actually found it to be challenging to find a true percentage to compare it to nationally. So if you guys can find it, feel free to drop it in the chat and let me know what you find. Had to give a quick plug to homeowners, as my wife is a real estate agent. So in the state of Wisconsin, we have 67% homeowners compared to 64.8% nationally. And I'm sure I don't even have to put it up, but 27% of Wisconsin are binge drinkers compared to 19% nationally, so much higher than the national average. And then we have a significant senior population approaching 1 million individuals greater than or equal to 65 years of age. All right, so now that we have the demographic and socioeconomic pieces to the state of Wisconsin, the next piece I wanted to highlight is health disparities at a state level. So another opportunity for participation, hoping we can take a second and get a few individuals' thoughts in the chat about what we think some of the top health disparities or challenges as it relates to health for the population in the state of Wisconsin is. All right, I'm going to give everyone the benefit of the doubt that it takes a little bit longer to type this one out. All right, I know access to healthcare and health literacy for sure. All right, for the sake of time, we'll keep moving and I'll run through some of the ones that I found for you all today. So the first thing that I want to highlight relates to heart disease and stroke. So the graphic that you're all seeing on the left-hand side here is heart disease risk factors by percentage of Wisconsin adults. So 67% of individuals have or are overweight or obese, and that is considered a risk factor for heart disease. Similarly, you can see for cholesterol, high blood pressure, binge drinking, and all those other factors, the percentage of Wisconsinites that have these individual pieces that are ultimately going to potentially increase the risk as it relates to heart disease moving forward. And on the right-hand side, as a state, 1 in 3 deaths is caused by a heart attack or stroke, so a significant portion of individuals in the state of Wisconsin. From a stroke standpoint, we have just around 2,300 strokes annually, but more concerning is the 8% of individuals are having it prematurely or before that age of 65. And then also when we think about heart disease and stroke, if you're an individual over 45, the odds you can see there within dying 5 years after that first event is over 1 in 3 for men and almost 1 in 2 for women, or 47 and 36% respectively. The other thing I want to highlight as it relates to the state of Wisconsin is the percentage of individuals with diabetes and pre-diabetes. So the graph on the left is a heat map. You can see the legend or key on the bottom left, where the lighter the color blue is the lower percentage of the population that has diabetes. And as the blue progressively gets darker, that means there's a higher percentage of individuals with diabetes in that population. As you can see in Dane County on the bottom middle of the state of Wisconsin, there is a relatively low percentage of individuals with diabetes at roughly around 7%. And then as you go across this state, not exactly sure what's happening in Menominee County, but they're well above even the second closest county with 16%. So I'm not sure if we need to check their water for having glucose in it or what, but significantly higher than the second runner up, which is around Milwaukee County, still in the double digits at 11%. If we look at the image on the top right, Wisconsin as a state is a glass almost half full, if you will, as it relates to diabetes, with 9% of individuals already having diabetes and roughly a third of individuals being classified as pre-diabetic. And of those, 34% or 1.5 million individuals in the state of Wisconsin, almost 90% of those individuals are actually unaware that they have prediabetes, which makes it certainly a challenge to take the appropriate lifestyle changes going forward to help curb the potential of transitioning into diabetes going forward. And as we look at the prediabetes population and moving into diabetes, we can certainly think about the healthcare associated costs, as it can almost attribute to up to $10,000 annually to treat said patients. The next one I want through is hypertension. In the state of Wisconsin, we have a little under or around a third of the population that has hypertension. And if we look at the graph starting on the left-hand side here, of those 1.3 million adults with hypertension in the state, less than half of them are controlled, so at guideline recommended blood pressure levels and appropriate therapies, which means over 700,000 individuals in the state of Wisconsin do not have their hypertension under control. And you can see on the right, taking that a step further, there are roughly 44% of those uncontrolled who are actively receiving treatment, but still considered to be at uncontrolled blood pressure levels. But conversely, there are almost 300,000 individuals in the state of Wisconsin who are unaware they have hypertension. And equally or more so concerning is the 100,000 patients who are aware and still untreated of their hypertension. And then the other piece that certainly can have some challenges as it relates to both hypertension and diabetes and keeping these under control is medication adherence, but across both of these chronic conditions, roughly only 3 out of every 4 patients are adherent to their medication. So certainly another challenge as it relates to preventing prediabetes to moving into diabetes and or controlling blood pressure. Another issue in the state is as it relates to BMI, so thinking about our patient population and being overweight or obese. The graph you're seeing here on the left is slightly out of date. You can see 2010 to 2014 with an uptrend to almost 70% of the state being overweight or obese. We're actually starting to trend in the right direction. We're now down to 67% in 2021. But overall, if you break it down by obese, overweight, and individuals within a normal BMI, that equates to roughly 3 out of every 10 individuals in the state of Wisconsin being obese and 4 out of every 10 being overweight or having that BMI between 25 and 30. And then as it relates to being overweight or obese and looking at all the conditions across the individuals in the state of Wisconsin, the percentages you're seeing there are of the individuals in the state of Wisconsin who have diabetes, 89% of that patient population is overweight or obese. And then you can continue to read down as it relates to the others. So 82% of individuals with heart disease are overweight or obese, and so on. Another concern within the state of Wisconsin is certainly alcohol use. So we actually ranked third in the country for the percentage of adults who currently drink. That comprises roughly 65% of the population in the state of Wisconsin, with Washington State actually being the highest, a whole 4 percentage points higher at 68.7%. But of course, in true Wisconsin fashion, we do have the highest rate of binge drinking in the country. I thought this was a relatively fair comment, saying when Wisconsin's adults drink, they drink more often and have more alcohol than adults in other states. And I'm sure this is certainly true for several of us on the call who recently made the trip to mid-year at some point on that trip. But in all seriousness, it is an issue in the state of Wisconsin. You can see on the graphs on the right-hand side there, we are seeing upticks in the trends as it relates to both alcohol-attributed death and ED visits as it relates to our alcohol consumption in the state of Wisconsin. Now, we talked a lot about the challenges with the different conditions across the state, but equally as challenging or concerning are the factors that are outside of patient control, which in this particular instance is relating to provider shortages. So within the state, there are 3 large buckets that we can factor into for provider shortages, primarily focusing on primary healthcare, dental health, and mental health care. So similar to the other graphs, we have a heat map. So the colored in different counties are those who are deemed to have a provider shortage. And even if the county as a whole isn't highlighted, you can also see little triangles sprinkled across the state with facilities in particular who are going through provider shortages. And underneath each Wisconsin, for each respective provider type, is what is considered to be an adequate level of providers. So for every population factor of 2,000, there would be considered to need 1 primary care provider. Conversely, 4,000 for dental health and 10,000 for every 1 mental health care provider. I'm sure this isn't a surprise to most of us, but if you do a quick search about provider shortage, there's a plethora of different articles that come up, and certainly approaching it at multiple different angles, but can certainly see a common theme here as it relates to pharmacists. One, either having the opportunity or skill set to fill the gap, a call to action, or ultimately saying they are the providers in that space, as you can see on that left middle comment talking about pharmacists being the only one providing care in some medical deserts across the state of Wisconsin. So provider shortages is certainly a challenge, but another challenge across this state is access to care and drive time to care in multiple different settings. So 2 of them that I wanted to highlight today. First one relates to ability to access emergency care. So again, if you haven't figured out by now, I'm a visual learner and have some heat maps here to help us follow along. So as you can see, green is representing individuals who are within 10 minutes to emergency care. Yellow represents within 20 minutes to emergency care. And red means that you're within 30 minutes of emergency care. And if you're white, that means you're beyond a half an hour to emergency care services. So quickly becomes understandable as it becomes a challenge for those in the northern part of the state with a lot of white space to find it challenging to see to emergency care when they need it, and oftentimes maybe delaying how early within their need for care they go in and ultimately have additional complications or challenges due to said delay in seeking care. Similarly, as it relates to stroke centers across the state, if you look at the dark gray on this map, that means it's within 20 minutes to a hospital stroke center, or light gray is 20 to 60 minutes. So you can see across the state there is certainly a lot of white space as it relates to the time to seek care and how far patients will have to travel. And this is certainly an instance where time is of the essence with the ability to provide therapies within a set window, and certainly that can be inhibited by the amount of time a patient may have to travel to seek appropriate levels of care. All right, so we went through a bunch of different challenges across the state from both a patient health standpoint and providing care aspect. Wanted to focus on one more piece as it relates to the state of Wisconsin, and that's the Wisconsin Collaborative for Healthcare Quality, or WCHQ. And this health disparity report does a breakdown by disparities, and they look at it through a couple of different lenses. They look at the population as being in a rural or urban setting, and then within those rural or urban settings, through the assessment, identifying areas by zip code as underserved or advantaged. And then of note, for this WHQ membership representation, they actually make up 65% of Wisconsin primary care providers across the state. So through this assessment, you can see the state of Wisconsin on the left-hand side. In the blue are the zip codes that are considered to be rural. So we have rural advantaged in the lighter blue, neither advantaged nor disadvantaged in the medium blue, and then dark blue is rural underserved. And then on the right-hand side, you can see the urban groups, with urban advantage being the lighter peach color all the way to the burnt-ish orange color in the Milwaukee and Beloit region. So you can see in the Madison-Dane County area, relatively an urban advantaged area. A lot of the state, maybe even contrary to some thoughts based on the previous information provided, that the northern part of Wisconsin is considered to be just rural and not advantaged or underserved. But ultimately, from the WCHQ, they ultimately are identifying that there are still substantial disparities across all populations in the state of Wisconsin, regardless of if you're in a rural setting or an urban setting, regardless of if you're underserved or advantaged, there are still needs across all patient populations, regardless of which bucket you fall under. So by this assessment, what they're considering to be a disparity would be, as you can see on the left-hand side, there being a rating that is at least 10% below the highest response rate across the zip codes in the states. So for rural underserved, really focusing on the screenings, particularly calling out colorectal cancer, focusing on tobacco-free promotion within heart disease. For rural advantage, really focusing on vaccines, particularly HPV. Rural underserved, highlighting more so focusing on the childhood vaccines, and then really getting heart disease care optimally set up for patients. And then urban advantage, really focusing on depression screenings. All right, we made it through the state of Wisconsin. Next up, for objective number 3, we have Dane County. So similarly, going through some demographic, socioeconomic factors, and health disparities. So within Dane County, if we look at race and population, we are the second most densely populated county within the state of Wisconsin, behind Milwaukee County. Our population is over 500,000 strong, and certainly seeing that a lot of individuals like to be in Dane County as our population is on the rise, where we grew over 1% over the past year. And comparatively to the state, we do have a more diverse population, as you can see, closer to the 75%, with 78% white, with African Americans, Asians, and Hispanics all being over 5% throughout Dane County as well. And then when we look at Dane County, if we look at age and education, we are a relatively young population. You can see between 20 and 40 actually makes up roughly a third of the population with the two highest percentage groups. And then as it relates to education, we obviously have one of the largest colleges across the state, with UW-Madison being here. So you can see high levels of education with actually graduate or professional degrees being a higher percentage than bachelor degrees, both being greater than 35%. And as a reminder, that's in comparison to at a state average with only 20% receiving bachelor's degrees and 10% receiving graduate degrees. For Dane County, some of the other factors I wanted to highlight, our life expectancy is 81.8. So when you stack that up to the national average, there are over 2 years where we are higher than the national average. Dane County is slightly more responsible than the state as a whole as it relates to binge drinking, but still well above the national average of 19%. Similar labor force participation with that 66%. Slightly better BMI overall as it relates to percentage of individuals who are obese, with down to 25% compared to that 32. And we can certainly see the household average income is certainly well above both the state and national averages. We have those advanced degrees throughout Dane County. Certainly more of a renter population in Dane County, lower marriage percentage as we are also a younger population. And we are a younger population, as you can see, by 35.9, so 3 years lower than the state and 4 years longer than the state. All right, as it relates to disparities across Dane County has what is called the Community Health Needs Assessment, and is part of the Healthy Dane Collaborative. And it's something that's put together every 3 years. And right now we're currently in the 2022 to 2024 cycle. And I'm hoping that at least one of these health systems on the bottom left-hand side of the slide looks familiar to you. So through the Community Health Needs Assessment, it is a large partnership of several of the health systems throughout Dane County. So UW Health, Unity Point, Meriter, SSM, Group Health, Stoughton Health, all of those are participants of said needs assessment. And it really focuses on health, using a health equity lens to address types of unfair health differences, and looking at how they're closely linked with social, economic, and environmentally disadvantages that are adversely affecting groups of people going forward. So through this assessment, we have community survey response data. What you're seeing on this slide on the left-hand side of this table is a compilation of all the different groups and the top 5 community needs assessment responses by the community. And on the 3 columns to the right are broken down by the various groups who filled out the survey, which we have BIPOC, the Spanish language survey respondents, and then the white population. So for the most part, there are several common themes and an alignment across the top 5, with a lot of focus on mental health, substance abuse, healthy pregnancies, suicide and self-harm, and diabetes. If we look at BIPOC, one of the large ones there that isn't represented, all responses, is health diseases. For the Spanish language surveys, we also have the dental services. So there are slight differences amongst the different responders to said survey, but the top 5 there can be seen highlighted on the left-hand side. And although these were considered to be the highest need, survey respondents also had a lot of different responses as it relates to the highlights or strengths that they felt they had across Dane County, which you can see highlighted on the bottom side. So diversity, the welcoming or the neighborhood friendliness of Dane County, overall feels like a relatively safe place to be. There's a lot of things happening as it relates to recreation and fitness, and certainly we have some of the top school districts across the state as well. On top of looking at health needs, again, if we think about access and ability to care, I just wanted to highlight some of the comments that were brought up throughout the survey responses as well. So Few things that were highlighted, if we start at the bottom left-hand side of the slide here, is focusing on the provider and feeling more like a transaction than a person. So thinking about what are those objective data points that need to be collected rather than seeing them as a person and having that conversation. Again, seeing some challenges as it relates to the amount of time we have to wait to see a provider, especially if you're getting some referrals and how busy different providers are across the state. Another one highlights the need for providers, especially individuals who are representative of the patient populations they're seeing, whether that be including providers that are bilingual or of color. And then lastly, again, we've briefly mentioned this earlier, but also thinking about the hours that healthcare providers are available and what that means for individuals who can't meet those regular business hours and the level of care they then go through. So as you can see highlighted, urgent care and the ER, which certainly do cost more if that's the route taken. And then as it relates to providers for the survey response, what they were asked was to highlight over the last year if they've noticed any changes in a prompted list of health needs. And you can see their highest responses here with a lot of synergy and correlation to what the community responses were with mental health, suicide, and self-harm and substance use, but also sprinkled in some obesity, nutrition, and alcohol use things as well. Also missing compared to the community responses was less felt of a need as it relates to chronic disease state management and healthy pregnancies as well. So if we compile it all together, this assessment, ultimately, you see on the left-hand side, respondents were asked to rate based on which samples were prevented to say if they felt it was a less critical or a 1, somewhat critical or a 2, very critical or as represented as a 3 or 4, not sure. And ultimately, those pieces of information that were felt to be very critical were compiled together to create the table you're seeing here on the right-hand side with the priorities that are going to be focused on across health systems within Dane County for that 2022 to 2024 window. So looking at reproductive justice, chronic conditions, behavioral health, injuries, then also looking at health equity and social determinants of health factors as well. So for objective number 4, I wanted to have a brief discussion about new pharmacist-specific patient care initiatives that focus on identified disparities, specifically focusing on this needs assessment. So I wanted to take a moment for you all to enter some information into the chart. And based on this table and what was found in the 2022-2024 needs assessment, which pieces in this table below do you all feel that pharmacists could have a positive impact on to help bridge the gap or provide the need that the community is highlighting a need for? Yeah, I see some coming in. Chronic conditions, access to care, absolutely. So, like you all mentioned, I just wanted to highlight a few that first came to mind that are certainly some things that pharmacists can help move forward with. So, of course, chronic conditions and being available in the primary care setting as it relates to a lot of those different ones across the state that we talked about as a concern with heart disease, hypertension, and diabetes. There's certainly some growing avenues as it relates to behavioral health opportunities for pharmacists across the nation and in Wisconsin in particular. And I'm sure most of us, if not all of us, have had a conversation with patients as they're discharging as it relates to fall prevention and trip hazards and so forth within the home as well. So certainly another piece that could be a conversation as well. We certainly are doing a good job as it relates to leveraging language access where we have the interpreter services, but also looking through the lens of opportunities to get pharmacists who can speak the primary languages being seen within the patient population could be something as well. And then by providing health priorities, seen on the left-hand side, that certainly helps with the access to care hand side that we're seeing on the right with the social determinants of health. The other thing I wanted to highlight is Healthy People 2023 put together a handful of objectives to be met. And I just wanted to highlight some of them that were relevant to pharmacists. So this first one that we're going to be reviewing are things that ultimately the Healthy People 2023 objectives think pharmacists can have an opportunity to improve going forward. So as you can see on the table, several different ones as it relates to HIV care, making sure we're using guideline-driven therapies with those ACEs and ARBs for various conditions, preventative health care, treatment for addiction treatments, and then also telepharmacy care services can certainly be a big area of focus as well. And then conversely, some of the objectives that they're focusing on that pharmacists can help reduce has a large impact on the number of ED visits. And I'm sure we all know that our ED has been extremely busy as of late, and certainly want to do whatever we can as it relates to reducing those visits. So Healthy People 2023 or 2030, excuse me, is seeing some opportunities as it relates to COPD, diabetes treatment, and fall prevention, along with looking at other overdoses with anti-coag and opioids and so forth as well. All right, so for objective number 5, I just wanted to see what ideas are out there as it relates to opportunities for UW Health and providing equitable and inclusive patient care. By no means is this an inclusive list, but just wanted to provide some initial thoughts as it relates to some of the things we're already actively doing to provide equitable and inclusive care to our patients. So having a large focus on interpreter services, having our medication assistance program with opportunities to provide access to medications for patients who would ultimately otherwise be unable to afford a lot of different medications. Having a collaborative with the Badger Prairie Healthcare Center with some pharmacists going out there as it relates to site conditions. The outpatient pharmacy drug repositories, it relates to patients returning unused medications and having those accessible to individuals who are unable to afford copays for their medications upon discharge. And then our community health partnership with the EVU Pharmacy, which is a closed door pharmacy that serves a lot of the underprivileged Dane County populations as well, where there's a large non-English speaking population there as well. And then we have a Quartz Diabetes Initiative that's in collaboration with UW Health's ambulatory pharmacy team. And that's really a pilot that's looking at pharmacists working with patients in those populations for diabetes and looking at the overall impact that can be had as it relates to some of those 2023 population health objectives as it relates to ED visits, reducing A1Cs, and looking at opportunities to expand that service to help improve some of those chronic disease conditions going forward. So like I said, by no means is this all inclusive of the things we have going on at UW Health. And I just wanted to, before we wrap up today, just take an opportunity to see if anyone wanted to give their ideas as it relates to opportunities at UW Health for other things that we could be doing going forward. There are none that immediately come to mind. That is totally okay. With that said, I think some that initially came to my mind, and I see Shelby's got some on here, and more social work support in specialty clinics for sure. One of the first things that came to my mind is patient reach, specifically as it relates to patients in clinic locations that we don't necessarily have pharmacists. So how can we expand our access to pharmacists across all clinic locations where we're providing care? I think some other things certainly relate to the different languages that we have available on discharge medications. I believe we have some with English and some that we put together with Spanish, but really for those other language speakers can certainly be a challenge for our patient populations that we serve and making sure that they're adherent to the medications and know how to appropriately take them going forward. With that said, I just wanted to briefly wrap up and say I'm appreciative of you all joining the presentation today. If you have any questions or want to see more details as it relates to some of the information that was shared today, I can certainly pass along the slides as there are some links on this slide here to get more information about the needs assessment, the Healthy Dane website, and then also as it relates to the 2022-2024 implementation strategies that UW Health in particular has laid out to help mitigate all those different needs across Dane County that were highlighted. And with that, would love to hear any questions that you all may have.